Welcome. Thank you for joining us virtually for a press briefing. My name is Kelly Chandler, and I'm the Public Health Division Manager for Itasca County. Itasca County is hosting press briefings to highlight themes emerging in our community related to COVID-19 or frequently asked questions posed by our community members. We are providing weekly written updates for the media. Today we'll be discussing the topic that have been on our minds this summer, our local school plans for the fall. Safety and security are basic needs just above food and water and air on Maslow's hierarchy of needs. Our children's ability to learn and grow and develop is secondary to their safety and security. We have tremendous leadership in our schools in Itasca County, and they are taking the safety of students and staff very seriously as they plan for reopening. Governor Walz of Minnesota, along with the Minnesota Department of Education, disseminated their plans for reopening of schools 1 week ago, and their guidance is left up to our local school districts. But we need you. We need our community members now more than ever to do their part to stay safe from the spread of COVID-19. Our schools reopening is dependent on our behavior. We ask that each and every one of us, all of us, do our part. Wear a mask, stay home if you are sick or were exposed to COVID-19, social distance, and limit your activity in public spaces. We know that if an outbreak occurs within a school, it affects the students, the staff, the parents, especially if the parents are in the workforce. The effects go well beyond just the student or staff who are infected. There are ripple effects with positive cases. Our school leaders will discuss information on their plans for the fall as it pertains to their districts, and will learn more about COVID-19 and children from our medical professional. We are joined today by Dr. Dan Suhler, Vice President of Medical Affairs and Family Medicine Physician, Grand Itasca Clinic and Hospital. David Pace, Superintendent, Greenway Public Schools and Chair of the Itasca Area Schools Collaborative. Matt Gross, Superintendent, Independent School District 318, which is Big Fork and Grand Rapids. Dan Mckeon, Administrator of Bugoneg-Shig School. And Brenda Sparts, Superintendent and High School Principal, Nashwauk-Keewatin School District. And Dr. Jeff Pestia, Superintendent of Deer River Schools. During our question and answer portion, we also have Angela Cleffman, Chief Operating Officer of Big Fork Valley, and G. McDonald, President and CEO of Grand Itasca Clinic and Hospital. We will start with a situational update for Itasca. We have 135 Itasca County residents who have tested positive to COVID-19 cumulative since the beginning of the pandemic. We remain at 12 deaths. Our most recent death was 2 months ago in early June. The case age ranges for our COVID-19 cases are 6 months to 94 years. Cases are mostly community spread from both known and unknown sources. 23 cases were asymptomatic, meaning showing no fever or outward physical symptoms. 20 cases, it is unknown if they had symptoms or not, and 92 were symptomatic. 11 persons remain in isolation, and this does not reflect persons quarantined due to close personal contact with a known positive COVID-19 case. One aspect of school reopening is based on our case rates per 10,000 persons for a 14-day period. The most recent data available online is for the period of July 5th through July 18th, and Itasca County was at 9.29 for our 14-day case rate at that time. Our cases have slowed in the 2 weeks following that time period, and we're around 24 to 25 cases in the past 2 weeks. So our rate when we calculate is just over 5, but also noting that the Minnesota Department of Health and Education will be publishing these numbers online. One frequently asked question that I'm sure will be touched on today with our school administrators is on face coverings, and youth will be required to wear them. It is a part of the safe reopening plans. And face coverings do include masks, cloth or paper, but they also include gaiters or buffs. There are multiple options available for our students to utilize. And now we will move on to our panelists to discuss more about medical implications with COVID and children. I will now introduce Dr. Dan Suhler, Vice President of Medical Affairs and Family Medicine Physician, Grand Itasca Clinic and Hospital.
Morning, Kelly. Thanks for letting me join us, this group today. So children of all ages can become ill with COVID-19. Most kids who are infected typically don't become as sick as adults, and some might not show any symptoms at all. Current data from the Minnesota Department of Health as of yesterday shows 1,291 COVID positive tests in kids aged 0 to 5 years, which is about 2% of all positives in the state. And in the age group of 6 to 19-year-olds, there's over 6,000 positive tests in the state, which is about 12% of all positives. While all children are capable of getting the virus that causes COVID, they don't become sick as often as adults. Why this occurs isn't quite clear yet. Some experts suggest that children might not be as severely affected by COVID because there are other coronaviruses that spread in the community and cause diseases such as the common cold. Since children often get these colds, they might already have antibodies that provide them with some protection against COVID. It's also possible that children's immune systems interact with the virus differently than do adults' immune systems. Some adults are getting sick because their immune systems seem to overreact to the virus, causing more damage to their bodies. This may be less likely to happen in children. It also may be that children in general have had less exposure to the virus compared to adults at this point. Kids aren't going to work, they probably aren't going to stores as often as adults, and they certainly aren't going to bars or gyms. While children and adults experience similar symptoms to COVID, children's symptoms tend to be mild and cold-like. Most children recover within 1 to 2 weeks. Their symptoms, like adults, can include fever, runny nose, cough, fatigue, muscle aches, vomiting, and diarrhea. If your child has symptoms of COVID and you think he or she may have it, call your child's health care provider. Keep your child at home and away from others as much as possible, except to get medical care. Finally, there are many questions about kids' ability to spread COVID. So far, kids don't seem to be super spreaders, but since most schools closed around the country in March as the virus began to circulate, this really is an unanswered question. I suspect as kids resume more of their normal daily activities, such as school, sports, and other activities, there will be more clarity regarding their ability to spread the virus to others. And with that, I'll pause. Thanks, Kelly.
Thank you, Dan. And we will now move to David Pace, Superintendent of Greenway Public Schools and Chair of the Itasca Area Schools Collaborative.
Good morning. Greenway staff have been working all summer long to develop, of course, as we are all well aware, the mode of 3 different plans: an in-person plan, a hybrid plan, and of course, improving on our distance learning plan that was in place in March. Things that we have focused on, which will be presented to our board, not in a final draft on this coming Wednesday, include details in regards to transportation, food service, face coverings, and other screenings for both our staff and our students, along with the different educational delivery models. As we planned for these models, based on the current numbers, the recommendation for Greenway would be that we would start both elementary and secondary in the in-person mode. But in the same time, it is our responsibility to educate our parents and our community that even though we are in an in-person mode, we aren't in the normal in-person mode. There will be restricted movement within our buildings. Lunchrooms will be used minimally. There will be much more lunches in the classrooms. That will reduce congregations of students in specific areas within our school. Also, as you know, through executive order, all students will be wearing masks. Greenway has used desk partitions in classrooms in which spacing might be somewhat limited based on class sizes. So we have put in place desk partitions in addition to the masks that would be required. And additionally, as far as screening of students, we are placing the expectation that, and it is our responsibility to educate parents on, the items of screening students that may be sick, and to educate them that it is okay if a student is symptomatic or showing different symptoms of illness, please to stay home. It is that joint responsibility to make sure that we keep our school community safe and educate our other outside community to make sure that our cases stay down, that we can continue to educate our students in person, knowing that as our cases go up, if they would go up, that we would be moving to a hybrid model, which, you know, potentially is going to cut down the in-person time of our students within our classroom. So once we finalize our plan in the weeks ahead, it is, you know, we've been educating our parents as we've gone through all summer long, and that will continue. But being aware that we are open, our plan right now, based on the cases, we would be opening in person. But if, you know, if the number of cases change, we would be moving to hybrid model or distance learning.
Thank you, David. And we'll introduce Matt Gross, Superintendent, Independent School District 318, Big Fork and Grand Rapids.
Good morning, everybody. I guess many of the things that I would comment on are reinforcing what you said, Kelly, and also Mr. Pace. ISD 318 is committed, I guess, first of all, to using what we know about the sciences we heard earlier about, what we know about infection, what we know about the data in our local area, and using the model that we've been given as a guide. And so we're committed to doing that. We wanted all along to be able to do something that was transparent and that it was predictable, so our community could know along with us what our response would be. And we want to create a system that we're able to communicate out any shifting that we do and give people enough lead time to make the adjustments that they need to in their personal lives. Like Mr. Pace mentioned right now, and I think Kelly also, we're sitting at the period from the 5th to the 18th, that 9.29, that numbers come down, puts us in that band of in-person for all students. So that's ISD 318's plan as well, to be in person for all students. And again, with the understanding that it really is going to be up to our community whether that continues. It's going to be up to our community to keep cases down or reduce the number of cases we have, and we can do that by taking the precautions that Kelly mentioned. One of the precautions that Mr. Pace mentioned again is masking. It's probably the number one question that I get about what will school look like, and it's understandable. It's become a political issue, and I guess from my position as a superintendent, I just am urging our community to remove the political component of it and just make this about being in school or not. That is one of the requirements of us being able to have children in school, and especially for our youngest learners, we think that's crucial, that there's an opportunity to have connection there between the adults, the caring adults in the building, and the children. And so if we prioritize that, if our community prioritizes that, then we have the ability to influence that. So, like Dave mentioned, in-person does not mean business as usual. We are making changes to what our lunch and food and nutrition services look like, precautions on buses that we don't take in a typical year as far as sanitization and masking and things like that. Traffic flow within buildings is different. We'll space as much as was feasible within our schools. All those changes that we know are going to be important to keep things at bay as long as we can. And we'll be ready to shift if we need to shift. We heard on Tuesday about activities too. That's another question that we get a lot from parents, what's happening with fall activities. And we heard that fall football and volleyball are shifting to spring, and other activities are going to be held with reduced schedules and competitions this fall. Our plan will be approved by the board today, this afternoon, and it will be out to our community either tomorrow or Monday. We're going to be seeking input from that plan through a system called Thought Exchange, where they'll be able to give their input on the plan and also respond to other people's ideas. And then we'll be asking during the period of Monday through the 16th for parents to sign up or register for what model of education their children are going to be attending school at, whether that's in person with us or at home. And we're also planning, like Dave said, trying to keep those transitions between models as seamless as we can so that we can have continuity if we have to shift from face-to-face or in-person to hybrid, or from hybrid to distance learning. We want that transition to be as smooth as we can. So I'll stop there.
We will now introduce Dan Mckeon, Administrator, Bagonegishig School.
Hey, good morning, everybody. First, thanks for the invite to be a part of this conversation. So a couple weeks ago, our school board voted to utilize an online model for the upcoming school year, but with a variety of in-person supports for students. So something that's unique about us is that we serve students from a wide variety of counties, including Beltrami County, where the case rate per 10,000 is in the 20 to 29 band. And that suggests that a hybrid learning model is something that a school should consider. But the other thing that's unique about us is we have a high percentage of students who live in multi-generational homes, and or a high percentage of students who live with adults who would be in the high-risk category. And so for those reasons, our school board is choosing to start the year online. So what we're going to do is we are going to run our bus routes every day for food delivery, but also because it will allow us to be really fluid in the way that we provide those in-person supports to students. And so each day our buses will go out and they will deliver food, but each bus will return with a small number of students who will be coming into school. And those students will be coming in either to get their services that they get through their IEP. They might be coming in for some mental health counseling sessions. They might be coming in for academic tutoring, you know, if they're hitting some bumps in the road with their online learning. And so it's going to be a really fluid list of students who are coming in to see us each day. We're anticipating some days we'll have maybe 30 students or up to 60 students who would be coming into the building. And like the other school leaders have discussed, you know, we're going to have a lot of distancing measures in place, and masks, of course, will be required. So our current work right now is around, we're really working to get all of our households hooked up to the internet. That was a big challenge for us in the spring. About 50% of our households did not have reliable internet, so distance learning was pretty tricky in the spring, but we're hopeful that by getting everybody connected online, that our online distance learning this fall will be a big improvement. And then we're also working to develop that system by which we'll get kids into the building on a daily basis. Like I said, it's going to be a very fluid list of kids. There'll probably be some kids who come in each week for 2 to 3 days. And then there'll be other kids who might come in 1 week to get some help with math or something else. But then maybe they won't come in again for a couple weeks and they'd be off the list for a little while. So it's going to be a very fluid situation. We're going to try to stay nimble about it and, you know, just make sound decisions as new data comes into play around infection rates, and combine that with what we're learning about how to run an effective online program for our students. So that's the update from Bagonegishig, and again, thank you for inviting me to be a part of the conversation.
Thank you. And we'll move to Brenda Sparts, Superintendent and High School Principal, Nashwauk-Keewatin School District.
First of all, thank you for having me. If you don't know me, again, my name is Brenda Sparts. I'm just starting, almost literally just starting, but that's okay. I come to you from Moore Public Schools, where I was the COVID coordinator and making sure that their school had their plan in place, and that's all buttoned up over there. So I'm very familiar with all of the elements, all the guidance. So just because I'm just starting doesn't mean I'm fresh. Been doing this all summer. So I just want to assure you that all of that is okay. Nashwauk-Keewatin has been working over the summer on what they're calling the Restart Blueprint. They do have a lot of their plans in place already. What we need to do is take the most recent guidance from MDE that came out on July 30th and make sure that the plan has all of the elements and the changes that came about with that document. And so we'll be doing that today, tomorrow, and Monday. We plan to get communication out to families as soon as possible. It's so important that families have the information so that they can begin planning for the fall. Going with what Itasca County's numbers are right now and following the MDE learning model parameters, Nashwauk-Keewatin would be all in person right now. Again, just reiterating that in person doesn't mean business as usual. It won't be the completely traditional model that we're used to, but all kids will be at school every day. So what that looks like will be in our planning process, and we'll, again, make sure that gets out as soon as possible. I just want to make sure that people know that there is a part in the plan, which Nashwauk-Keewatin is calling remote classroom, for families that have health considerations for their students or for a family member and students can't attend school. Or if by preference, families will have a choice to continue to have that distance learning model for themselves, even if we are all in person or even if we do hybrid. So just note that that is an option. We want to make sure that you get an equitable education, that you get everything you need, that you are supported if you choose that remote classroom model. We will be sending stuff out very soon. So if you want to register for that program, you are more than welcome to. So with that, that's about all I know right now. And I just appreciate this opportunity to introduce myself and be a part of this.
Thank you. And we will move on to Dr. Jeff Pestia, Superintendent, Deer River Schools.
Well, good morning. Another one of the new faces here. I previously served as the superintendent for the Canyon-Wanamingo schools and the Hastings Public Schools, which are both in southeastern Minnesota. Been living here in Deer River for over a month now with my wife, who is a registered nurse. So very interested in this topic as well, just following along. Plans for the fall. We have a school board meeting on Monday night, so August 10th. And at that point, I'll be making a recommendation that we offer our Warrior Online program, which is required to be an option. And we will also have an in-person option, but technically our version will be labeled as a hybrid because we will have students on customized schedules. Some students will attend every day beginning on September 8th. Some students will attend every other day, depending on what we determine, our staff determines along with the parents what their needs are. And we'll also have childcare available so that we can cover students in need of supervision on their alternate day. Because we are offering these options, we're actually determining those customized schedules based on which parents select which options. And so I'm working on the registration document right now. We anticipate that we'll have that out immediately after the school board meeting or earlier, and begin to have some public information sessions to help people complete the registration document. So much like the other schools, whoever was enrolled at the end of the school year, if they haven't notified us as a change of enrollment, they're still enrolled, but we need to get them registered because we have to build our programs based on the choice that they're making because they're empowered with that choice. We believe that based on our demographics and our school buildings, that kind of getting off to this rolling start is going to be the safest option. And we anticipate continuing to move forward. It's up to our community to help us out with keeping some good public health numbers, because if we can get through our data from Labor Day weekend and be in good shape, then we would plan to proceed to bringing back any of the alternate day students into full-time as well. So I'll stop with that and hang on for questions if they come up later.
Thank you. And we are now moving on to our question and answer portion of the briefing. And we ask that our local and regional media submit questions via chat, introducing yourself, your name, and the media organization you represent. We have Beth from ICTV. With the changes in the in-person models, will the schools increase or change their counseling or mental health approaches to work with children struggling? Before we put that out for an answer, I do want to add that in 2 weeks, our next press briefing, we are still focusing on schools, but focusing on some of those other supports, and mental health will be one of the issues addressed. But with that, would one of the superintendents or perhaps David from IASC, if you've discussed it, does someone want to take that question on?
Well, I can start. From Greenway standpoint, in our middle school and secondary, we have 2 counselors and a social worker. We also receive counseling services from Children's Mental Health Services. In our elementary, we have a social worker, and one of the things that our counselors and social workers are doing is they will be touching base with a lot of the students, that they have past experience with, but also reaching out to further students, to more students as far as when they're reintroduced back into the system. Right now, currently, we have a pretty good system and opportunities to meet with our counselors, and we have crisis teams within each building that continually meet to identify students that have potential needs that they may not be so open to come out and talk with our counselors. So.
Did anyone else want to add anything to that?
I guess I would just add that the supports that Dave talked about, I think if we look across our school districts represented here, or schools, we have counselors and social workers, mental health practitioners in our buildings. And that having the fact that we have those supports in place is one of the reasons why I think we continue to be a good option for our parents and our communities to choose their local schools, because those supports don't exist in every situation. In online learning providers, maybe outside of our school districts, those kinds of supports don't exist. So we have counselors, we have school social workers, we have student support specialists, we have truancy prevention people, we have mental health practitioners, all those layers built into our school districts. And I think those add some of the safety nets that our students rely on and need.
I'll jump in on that one too, because it's just such an important topic. If you think about it, from a timeline, we shut everything down in March, and now we're going to open things back up. That's a lot of time in between, and a lot of things have happened. So there's been a big gap in support for students. So we know the need is great. And Deer River obviously has the same type of supports that the other superintendents have talked about. We're also a full service community school that offers supports that are unique in that perspective. And one of the other things that we're really emphasizing in the way we build our modified schedule for coming back to school is that when students come in the morning and when they leave at the end of the day, and this includes our Warrior Online students, they should be following the same schedule and connecting with their teachers in the same interpersonal way, just not face-to-face. But we have these closer relationships being developed between the homeroom teacher or the advisor at the secondary level, that they'll spend time every day just talking about what's going on in their life, whether it's health related or other things, and they'll kind of be in a qualitative way be a part of the screening process of are they healthy and are they ready to come back to school. And then we'll try to end every day that way as well, because it's right now it's the most important thing besides catching up on the academics is finding out how they are and supporting them and their family.
Thank you. We are getting to the end of time. We have 2 more questions. If everyone is okay with going a little bit over, we can take these last 2 questions. So Jennifer from ICTV, I heard Matt Gross say on Tuesday we're having choir and band instructors figure out ways to have these classes. There will be FIED without the requirement of face coverings. I'm worried the district's doing too much. Admiring the plans to bring students back, but wondering if we should be focused on the core classes.
Yeah, I guess since I was the one that she heard talking, I'll jump in there. I think the first thing that everyone needs to keep in mind is that everything that we do has to be through the lenses of how do we do this in a safe way. If we can't do FIED in a way that's safe, we can't do FIED. If we can't do choir and band in ways that mitigate risks as much as we can, then we can't do those things. So everything's going to be through those lenses, because ultimately, if we believe, like we do, that having kids back as much as we can is important, it's in our best interest to program in ways that makes that possible. So I didn't necessarily intend to mean that, for instance, FIED is going to be, normal FIED. We can have FIED outside, and we should in the fall when it's beautiful outside and we have space to do that. The mask requirements talk about strenuous exercise being when mask requirements are modified. So if the activity is not strenuous, then we need to revisit whether the mask should be on during that FIED activity. So every one of those decisions has to be made with, can we operate this class, this course, this activity in a way that, works with the guidelines and works with the requirements.
Thank you. And our last question, Kathy from KOZY. Masks have become political. If a student removes his or hers and refuses to wear one, what kind of tools will teachers have to enforce mask use? Who would like to address that from our schools?
I guess I'll jump in and, there's been lots of discussion, and, this is going to be an education point for our community, our students, that one, the mask is mandated. Number two, the mask is one tool. Wearing that mask during the school is going to be one tool to make sure that we stay open and don't move to a distance learning model. And thirdly, and of course, there's different views on this, but every school district has dress codes and dress responsibilities and clothing that isn't allowed. Because this is an executive order and we are a public entity that is required to have students, in the building, and a mask is required with that. A lot of that is going to fall under our dress code, just like if a student wears inappropriate, t-shirts and things like that, they're going to be asked to remove them, just like that would be the expectation. It is very important that we maintain our ability to open and not move into distance learning. We know that every model can meet students' needs in certain ways, but we all know that being in an in-person environment in an educational setting is the best model for our students. And we have to do our best. I mean, when the public talks about opening safely, this is one avenue in which we know we can open it safely.
Great. Did anyone else have anything to add before we end today? We're a few minutes over.
Well, I guess I mentioned on Tuesday, and I just piggybacking on what Dave said, I think that I'd agree with Kathy that it's unfortunately become political, and I also think that masks are much more an adult issue than they are a child issue. If we model what we want to see from our children at home, they will do it. If we practice wearing masks, even with our littlest learners at home for a minute or 2 minutes at a time, they'll learn how to do that. And there's a Boys and Girls Club program running right down the hall from me right now. And those kids sign in, they put their masks on, and they get to it. They've learned to adapt. And so as the adults, I think if we encourage our students and help them understand that, like Dave said, this isn't about masks, this is about attending school. I think we can shift that narrative to a place where it's not political, or at least not affecting the kids in a political way.
Thank you. And thank you all for staying on a few minutes extra. Have a great rest of your week and stay well.
Thanks,
Thank
Kelly.
you.